Hello, I'm Dr. Elizabeth Dilday, and I'm a physician at CCRM Fertility in Orange County.
It can be both. So we know that cancer treatment, depending on the route of administration, the type of treatment planned, and so many other factors can impact fertility. But often the cancer itself, depending on its location, may impact one's ability to get pregnant as well.
So I feel like most patients, the model of treatment is doing fertility preservation before your cancer treatment begins. So that is the gold standard. That would be through embryo freezing or egg freezing once you've been diagnosed with cancer and before you are starting your treatment. But we know as physicians that this time is extremely stressful for patients. They're being flooded with a lot of new information, and they're being pressed to make very important decisions about their futures, which may be more immediate or maybe decades in the future, depending on their age at diagnosis. So while the gold standard would be to intervene and do some sort of fertility preservation treatment before your cancer treatment journey begins, there are options for patients who don't do that. So there may be a window. A classic example is breast cancer patients. They may receive their diagnosis and have a surgery planned, a lumpectomy or a mastectomy. And then there may be a window before they begin the next phase of treatment with chemotherapy and or radiation, where we could do some sort of intervention then. And I should also add that if patients can't do the embryo freezing or egg freezing, that process does take about 2 weeks. It's an outpatient surgery. We know that many of our patients may not be able to delay their treatment by 2 or 3 weeks. And also we know that some patients might not be physically well enough to undergo outpatient treatment and outpatient surgery when they are diagnosed. So for those patients, we want to make it work for them, and we're happy to explore other options. What I tell those patients is that they are going through probably the hardest thing they will ever have to go through in their lives. And what I try to tell them is that let us be sort of the bright spot in your medical care right now, something that gives you a little bit of a glimmer of hope about life after your cancer treatment and what that may look like. So I try to keep it positive and provide them a lot of support and encouragement. And again, a place that they can hopefully exhale and feel like they have something to look forward to on the other side of their cancer journey.